All right, guys. So we were just talking about, people who have died by suicides, and some people, finding no way out. And actually, on the line with us right now is the psychiatrist consultant. We have Dr. Ian Hypolite, who's going to help us delve into this conversation just a little bit more. Dr. Hypolite, good morning, and thank you so much for joining us on the Now Morning Show.
Good morning. Thanks for having me.
Now, Dr. Hypolite, one of the first things that that relatives often tell people about, some of the victims who died by suicide is that they never saw it coming, right? They were normal, they were operating, doing their usual routine. I mean, how do we spot some of these signs that, this person might be having suicidal thoughts?
Well, that narrative of not having a warning can happen. It does happen. But invariably, suicide is preceded by warning signs. Under normal circumstances, we associate suicide with depression. And of course, people might be able to spot when a family member or relative or friend is depressed. But in addition to that, suicide may also occur with psychotic disorders. People may be responding to, for example, the stimuli, voices that tell them to do things. And suicide can also be strongly related to substance abuse. So that there generally tends to be a warning sign, so that we can have the narrative where people can say, well, there was absolutely nothing to give me a hint that this would happen. But that is not usual.
Right. Now, I was wondering, Dr. Hypolite, is suicide linked to any other disorders? So, for example, people might have anxiety, they might have, bipolar disorder. Do we see this happening often?
Yes, as I indicated, we tend to link suicide with depression, or I would say rather the mood disorders. Depression most commonly, but can occur, for example, with other mood disorders, including anxiety and bipolar disorder, and as I mentioned, substance abuse, and also with psychotic disorders where people's reality is distorted.
Now, Dr. Hypolite, there are often times that people have, suicidal thoughts, and some people think this might be harmless. I mean, how do you transition from having a suicidal thought to actually, doing the action?
Well, a suicidal thought is not a harmless phenomenon, and I think we have to convey this to our listening audience, that if perchance you begin to have suicidal thoughts, you definitely should seek help. The ability to transition from a thought to action is a very, very potent thing. A lot of people do have thoughts but cannot put it into action, but we cannot take for granted. We cannot take that for granted and assume that because people think that way, they will not do it. Urgent professional help is needed.
Oh, good morning, Dr. Hypolite. Ayana Carter here. I just wanted to ask, what were some of the warning signs when, if you're looking for warning signs for your loved ones or friends, what do we look for?
Yeah, if we are looking at, for example, the mood disorders, invariably the person would appear to be of low mood, different from how they would usually appear. And when I talk about low mood, I'm not talking about instantaneous low mood. I'm talking about persistent low mood. And that gives some sort of cue that something is going wrong with the person. So low mood, not enjoying things or life as they generally would, or also having other disturbances, appetite disturbances with weight loss, sleep disturbances, and you may get expressions in respect of their desire to live, expressions of sense of hopelessness or worthlessness. All of those things are possible indicators. As I said, it is distinctly possible that someone can be going through that particular or those particular experiences and no one else knows, particularly if one is isolated, and isolation and withdrawal can be part and parcel of of that syndrome. But generally, family members or relatives or friends who are tuned can pick these up. But remember, I said that there are other things that may be associated. Anxiety, for example, severe anxiety is a fairly good predictor of suicide, particularly if it accompanies depression, which it does in most cases. And of course, rampant substance abuse and all of the the problems that arise with, for example, psychotic conditions where people may actually respond to voices, for example, that may tell them to kill themselves.
In that case, what are some treatment options then if you identify that your friend or loved one may be exhibiting suicidal thoughts or may have suicidal tendencies?
Well, I think the first thing to do is actually to engage that person and essentially reach out to them, get their trust, and of course, once people start to express suicide, I think it is absolutely essential that a professional becomes involved. Generally, that professional would be a psychologist, but invariably a psychiatrist, because the psychiatrist is armed with the tools, for example, to medicate, because in a lot of instances, medication may be necessary. But of course, in some instances, talk therapy combined with medication is known to influence outcomes far more positively than one modality alone.
Dr. Hypolite, Natasha Lake, good morning. So I have two questions for you this morning as we talk about suicide causes and prevention. One of the first things is, we ask a lot about these signs and these symptoms, but we don't necessarily know how to treat with it, especially with the advent of social media, where we may see somebody who expresses the desire to commit suicide or they're having suicidal thoughts. So my question is, how do we treat with that? And secondly, for those who may be having those thoughts right now, what would you say is the best course of action to take to put a stop to it, or at least give some time for reflection?
I think it would be asking a lot for the layperson to take on the responsibility of addressing the person who has suicidal thoughts. Most people are not equipped with the ability to handle that type of situation. So I would reiterate that once that is discovered, then one needs to seek professional help as soon as possible, and that would be my recommendation. In some instances, or rather in most instances, where there's significant suicidal thinking, hospitalization might actually be necessary.
Now, Dr. Hypolite, there is no doubt that the pandemic has obviously had an impact on people's mental health. I mean, now that we're easing out of the pandemic and we're moving towards endemicity, I mean, how do we, get people away from that depressive state and start to, kind of live life normal again?
Well, moving away from the pandemic stage to, as you put it, endemicity, if in fact we are moving there, I'm not sure exactly where we are myself. But the fact is that that has nothing to do with the difficulties that people have experienced over the last 2 years. Difficulties arising from all types of situations, including financial situations, job losses, absence of our normal socialization outlets, which serve as outlets for stress, for example. That may be changing now that things are opening up, but we have the very harsh reality that people have really suffered through the pandemic in many, many ways. We must remember, though, that notwithstanding the pandemic, that Trinidad and Tobago has one of the highest suicide rates in the region. And of course, this was pre-pandemic. We have a suicidal rate that in fact exceeds the global suicide rate. So it has always been an issue for us, and I think it has been exacerbated by the pandemic.
Dr. Hypolite, let me thank you so much for coming on the show this morning and enlightening us a little bit about, what we can look out for in terms of, people who may be having suicidal thoughts, how depression, of course, plays a factor into that. And of course, if we are having these thoughts, how we can cope with some of these. So thank you so much, Dr. Hypolite.
You're very welcome.